Trouble focusing doesn't automatically mean ADHD. As a family medicine physician, I hear people all the time saying, "Oh, I think I have ADHD." But what they don't consider is how being distracted, overwhelmed, or mentally exhausted actually contributes to their inability to focus. Now, ADHD is a real neurodevelopmental condition. It's not just a social media trend or any type of character flaw. ADHD affects attention, organization, impulse control, time awareness, and emotional regulation. And in adults, it may look less like hyperactivity and more like missed deadlines, constantly losing essentials, task paralysis, chronic disorganization, impulsive spending, and even feeling like the brain just has like 30 tabs open at one time. Here's something that's important to know though. ADHD symptoms actually begin in childhood, even if nobody recognized them back then, and they need to be persistent for a diagnosis, meaning that it usually shows up in more than one setting and causes real problems in daily functioning. Now, we as clinicians, we don't just diagnose ADHD based on like a viral checklist that you might have seen on TikTok, or for someone who's just having a difficult week. Sleep deprivation, burnout, anxiety, depression, trauma, substance abuse, thyroid disease, medication side effects, learning differences, and major life stressors can all affect concentration that can resemble ADHD. And there's no single blood test, brain scan, or online quiz that can diagnose ADHD. A proper evaluation is necessary. You have to look at your current symptoms, your childhood history, daily functioning, mental health, sleep, and other possible medical contributors in order to get an accurate diagnosis. And if you are diagnosed with ADHD, just know that there are options to help you, evidence-based options. Treatments can include stimulants or non-stimulant options. Now, the right medication is going to be individualized for you, right? And it's going to be something that is prescribed to you if you are being treated for ADHD. But just know that there are so many things that can cause you to have an inability to focus. And when you talk about treatment, medication is not the only tool. Behavioral therapy, ADHD focus, cognitive behavioral therapy, skills coaching, training for children, and then school and workplace accommodations can also help. So for most people, the best plan combines medication when it's appropriate and practical symptoms that make your daily life easier. So if you have been diagnosed with ADHD, you don't know where to start, just start small. Use one calendar, not 5. When you have appointments set, go ahead and put them in your calendar immediately. Set visual timers for transitions. Break a big task into, small steps. So don't focus on the whole project. You want to keep your frequently used items visible, right? You can body double when you're trying to study. Remember to get some noise canceling headphones and just understand that you're not being lazy, ADHD can impair your focus and your cognition, but there are resources that are out there that can help you. I'm Dr. Erica R. Jones, MD. Make sure you like this video and share it with someone who may need to hear it, right? And if focus problems are disrupting your work, school, relationships, and safety, make sure you talk with your primary care clinician, your psychiatrist, your psychologist, or another licensed professional about these issues